Good morning. I do have a few brief remarks this morning. First, I want to give a shout out to my Director of Nursing, Dr. Kimberly Hardy, for her work this week getting our testing sites stood up, and a special shout out to all of the Pitt County Health Department staff who are out there sweating in this heat to provide COVID-19 testing to the community. We have had a response to this that is far above what we ever thought we would have. Our testing sites, two of the three testing sites opened on Monday. In both Monday and Tuesday, we collected in excess of 400 samples. We had anticipated we might collect between 150 and 160 samples per day. So we have pretty much done about 3 times the amount of sampling that we thought we would do, which is great, but it has imposed a tremendous strain on our staff, tremendous strain on our laboratory staff to get these samples processed. They are time sensitive. A sample collected today really needs to be processed within 3 days. So we need to get that sample labeled, processed, and to the lab at the hospital so it can be run. So we do have a bit of a data backup. We are working to resolve those issues. The amount of time that our staff is spending in the heat really raises a serious safety concern for us. Again, in conceptualizing this operation, we thought that staff would be able to duck inside the structures and cool off in between sampling. Because of the volume of sampling we've done, our staff have just been out in the heat and in the sunlight, and we really have some concerns about our staff suffering a heat-related illness such as heat stroke or heat exhaustion. Given those things, we feel that we probably are going to need to modify our testing schedule to limit those hours a little bit for the protection of our staff, and also so that we can handle the amount of samples being collected, because we're collecting 3 times as many samples as we thought we were. Let me assure you, we will continue to offer free testing to the community as long as that funding is there and until that funding is exhausted. Moving on Saturday, July 18th, this coming Saturday, the Andrew A. Best Medical Society, in conjunction with the Old North State Medical Society, will host a free COVID-19 testing event at the Koinonia Christian Center. I'm going to hold up the flyer while I talk about it. Testing is available for those 18 years of age and older. Testing will begin at 9 a.m. and end at about 2 p.m. Please see the event flyer. This event is also being supported by Pitt County Health Department and Pitt County Emergency Management. We'd like to, their goal is to sample about 300 people. Given our sampling this week, I'm hoping that they meet their goal without any difficulty. In the past, I have mentioned a prevalence study that we've been working on with ECU, Brody School of Medicine, and their Department of Public Health, the Academic Department of Public Health. My friend Dr. Aaron Kipp is here this morning to talk about that, and we're going to let Aaron have a turn at the podium here. I don't know if, Kim, if you want to go next, or if you want Aaron to go next, and then we'll take your questions, I guess. You want to do prepared statements first and then questions, or do you want to do questions while I'm here? All right, I'm going to let Dr. Hardy step up, and then I'll take your questions.
Good morning, everyone. I'm going to speak real briefly because I've got to get back and work on getting test results to our population. We have started getting results reported as of this morning, or actually yesterday afternoon, from Monday's testing. We will say that we have gotten some positives in that batch, so we will be contacting people today. I want to piggyback on something that Dr. Silvernail said. He said that we were possibly going to revamp our approach. What I'd like to encourage the population, our public, to do is to call our agency for appointments for COVID-19 testing. We will be opening up additional slots for appointments, so even though we may be compressing the schedule and doing less hours out in the field, we will open up our capacity for the morning schedule. So if you have not taken advantage of coming in for free testing, please come in. That's what I want to say about that, and I think that is all I have. And my name is I'm Dr. Kimberly Hardy. I'm the Director of Nursing. And as Dr. Silvernail said, our staff has been absolutely phenomenal. Troopers being out in the sun from 7 to 4 or 5 o'clock in the afternoon. And as you all know, temperatures are topping 95 degrees. So just a shout out to all of our staff members who are working in the field to make sure that this is working properly and that you all can get through and get out in a timely fashion. Thank you.
Next, we're going to have Dr. Aaron Kipp from the Brody School of Medicine come up and talk to you about the COMPACT study. Dr. Kipp?
Well, good morning. Thank you. As Dr. Silvernail said, my name is Aaron Kipp. I'm an epidemiologist and assistant professor at East Carolina University in the academic Department of Public Health, which is in the Brody School of Medicine. I've been working with Dr. Silvernail and Amy since April on this project. This is the first time I've met them in person, so thank you again. You have a lot going on your plate, so I'm really grateful for their work with us on this study in the midst of all they're doing to respond to what's going on in the county here. So let me just take a few minutes to talk about this study that we're doing. It's a community study to better understand COVID-19 in Pitt County. As you know, the virus is still spreading, and it's still important to practice hygiene measures, social distancing, and wear masks. We must be vigilant in that. At the same time, we need a better understanding of COVID-19 epidemiology. The Pitt County Community Prevention and COVID-19 Testing Study, it's a mouthful, it's the COMPACT study, which Dr. Silvernail has talked about, is going to help us do that. It is actually a collaboration with the North Carolina Division of Public Health, UNC and Duke. UNC and Duke are doing similar studies in other counties around the state. And we're just thrilled to have Eastern North Carolina represented and at ECU to be involved in this truly statewide collaboration. We are currently conducting a survey of Pitt County residents to learn the social and economic impact of the stay-at-home measures, adherence to prevention measures, as well as some underlying medical conditions that may be these risk factors for infection and complications. So we are inviting anyone who has lived in Pitt County since March 1st and is at least 18 years older to take this survey. It's an online survey. The more residents who participate, the more complete our understanding will be. It's a one-time survey that will take about 20 minutes to complete, and it can be found on our study website. It's on these flyers that we're distributing, compact.ecu.edu, compact.ecu.edu. And you can read more about this study there on the website. Our goal is to have a survey that reflects the experiences of everyone in Pitt County, all the residents, across the range of ages, gender, race, ethnicity, from low income to high income, from those inside Greenville, outside Greenville, whether you've been tested once, twice, whatever, we want to hear about your experiences. Those who participate in the survey can enter a drawing for one of 10 $100 gift cards that will be providing as a bit of an incentive, and we hope the survey will be open through at least the end of July, perhaps into early August. Finally, to start wrapping up, once we have done a round of these surveys, we will actually be randomly selecting a small group of those individuals, about 375, who have provided us with their contact information to be part of a small follow-up study. This will be a group of individuals followed now, about August, through about April of 2021, so about 9 months. And this group will be invited to complete a survey every couple of weeks, do a simple nasal swab every couple of weeks. This will be a simple swab about 1 inch into your nose. It's not quite the same as the one I think a lot of folks are doing. They stick the swab way back. So it'll be hopefully less uncomfortable. Doing that every 2 weeks. And we will also be doing, taking a small amount of blood once a month for antibody testing. So through this study, by collecting symptom surveys, repeated nasal swabs, and repeated blood testing for antibodies, we can really create a complete picture of what does current and past COVID-19 infection in Pitt County look like, and what proportion of people are asymptomatic, but still may potentially be infectious. So we can understand a lot of information from that follow-up study. I'll go ahead and stop there. I'm happy to answer questions, but just want to iterate that we are actively inviting Pitt County residents to participate in our online survey about their experiences with COVID-19. We want to hear from you, and I understand that some of this information will be distributed, posted on the Health Department website, some other locations. So be on the lookout for compact study, and we'd invite you to participate. Thank you very much.
Did you guys want to do questions? I know Lee has a statement she wants to make too.
I just want to make sure to get the numbers from Monday. You did 440 tests. How many of the results have come back and how many of the results are positive?
We still don't have all those back, Ginger. Like I say, this created a backlog in processing on our end. I know we've had, Kim said, about 24 or 27 come back positive out of Monday's sampling so far.
And you don't know, that 24 came out of the 440, we've already received like 200 tests and 24 positive.
Something on that. I don't have the exact numbers this morning. We will clarify that later as that becomes available. No, I'll take questions from.
Okay, I'm Representative Candy Smith.
Oh, hey, Candy. Sorry, didn't recognize you.
So with these going forward, they come from Farmville, Rose High, they come from all those sites at the same time, or one site?
That was the total between the sites. Yeah, so we opened up at Rose and Farmville on Monday, and then Tuesday we were at Rose as an everyday site. The periphery of the county, we moved from Farmville to Bethel on Tuesday, and so Tuesday we collected at Bethel. Not sure the exact numbers from there, and forgive me, I went from 5 o'clock to the Board of Health meeting last night to home to my activities this morning, so I haven't really been in the office other than about 15 minutes today. But we collected there. We are at GR Whitfield today in Grimesland for the peripheral site, and still at Rose, collecting at Rose. On Thursday, we'll be at Ayden Middle School, and that'll be the rotating site. So one of the sites moves every day, and it'll go from Farmville to Bethel to Grimesland to Ayden Middle School, and then to the rural Winterville Firehouse, and that'll be the Friday collection site. And the JH Rose site will operate daily. Tomorrow, we plan to open the Moywood site at the Moywood Cultural and Recreational Center to collect within the Moywood neighborhood. So our collection numbers will go up. As I said, part of our I guess a miscalculation or an underestimation. We thought, looking at the number that were collected at Walmart, which was a daily operating site and free, that we might do something on the order of 150, 160 tests a day, and we've done 3 times that, more than 3 times that. So we underestimated what our collection volume would be, but there's a lot of processing that goes on behind after that collection, and then we do have the heat stress issues with our employees, which is really becoming a concern with running these sites for 8 hours at a time and not having enough staff to rotate them off. We're going to talk about that this afternoon, but we're likely going to compress to probably a 4-hour collection schedule each day. So still continue the same sites, but collect for 4 hours so that our staff have a chance to process those and get them out. Part of the design of this with using the Vidant lab was that we would have a 24-hour turnaround time. But if we don't get them into the hospital, they can't process them. So we need to be able to do our post-collection processing so that we can get them to the hospital lab and they can actually run the test.
What do you think it says that you're getting such large numbers? I mean, of people wanting to be tested. What do you think that says?
I think people want to know. I think people want to know if they have it, if they have had it. One of the things that we're not doing at this time is antibody testing. So there are some of the folks that are asymptomatic when they're tested who might be in the convalescent phase of their illness, but we really can't tell that because the PCR testing, while as great as the PCR testing is, it doesn't tell us if the virus is alive or dead. It only tells us if it's there because it looks for the genetic material of the virus. So it's a fantastic test from its ability to detect the virus and be accurate in the detection of the virus, and also in the absence of the virus. So you can rely on the negative test, but it cannot tell us if the virus is alive or dead.
And when it comes to someone being tested to the day that they get their test results back, what is that average?
We should be able to give that to them within about 48 hours using the hospital. The hospital will give us results once they receive the sample within 24 hours. So we should be able to turn that around in a couple of days. And that's really the reason for using the hospital lab as opposed to another commercial lab, is that we want that information to be actionable. And with many of the commercial labs, they're out to 5 or 6 days, maybe more at this time. So.
Just with myths and things that are out there, people are asking questions about the type of test
Mm-hmm.
That's being done, because they said there's other testing now that can be done. So are you guys at your sites only doing the swab in the nose?
Yep, we are doing what's called the nasopharyngeal swab, so that is the deeper swab, the brain tickle, some people refer to it as in layman speak. And then that sample is processed by a technique called real-time Pcr analysis. So it goes to the lab, and what they do is they are able to amplify certain segments of the virus's genetic material and then detect those sequences that are specific to the virus.
So is there one that does not go as deep and just right around the nose area?
Yeah.
You said something about that.
Yeah, there are other methodologies out there that are validated. What Dr. Kipp is talking about is it's called a nasal swab, a mid-turbinate swab. So that goes in about a ½ inch to an inch into the nose, past the opening of the nose and up in between the ridges in the nose. If you ever look up your nose and see those ridges, what we call the turbinates, it goes up in between the turbinates and the sample is collected there. There are some laboratories that can process samples that are collected from an oropharyngeal swab. So think like strep throat swabbing around the tonsil or the tonsillar bed. There have been some labs, and nobody in North Carolina that I'm aware of is doing this, where people could actually spit in a tube and they could run a test on saliva from some individuals, but that technology is not available at any of the labs that I'm aware of in North Carolina.
Is there one that has better accuracy than the other?
The one that's sort of considered the gold standard is the nasopharyngeal swab, but it's really about methodology, and it's that real-time PCR. And if it's real-time PCR, that methodology is very good. Any test is limited if a sample's not collected properly. And we think that with some of the self-collected samples that's been a problem, that people may not put the swab into their nose far enough to actually get an adequate sample. And I don't know that while I've swabbed a lot of people for strep throat, I don't know that I could swab myself for strep throat. I probably could, but I would still gag too. Everybody gags when you do that.
So Walmart, wasn't that a self swab?
That was a supervised self-collection.
That's your answer.
Mm-hmm.
If you're asking why people didn't go there, the word in the community was it was a self swab, and no one's going to do that as far enough as
Mhm.
necessary themselves. And so now hearing that someone else professionally would be doing it makes people feel better,
Mm-hmm.
because we've already talked about the test not being accurate because people are doing it themselves and not doing it accurately.
Mm-hmm.
And once that went out, a lot of people were deterred from going to Walmart.
Yeah.
I knew I wouldn't go because I wouldn't want to do it the way it should be done.
Mm-hmm.
I know that KCC Cornelia has testing on Saturday,
Mm-hmm.
and they're partnering with Andrew Best Medical Society. Does that go through the hospital as well?
They're going to use LabCorp for their testing. They had already, in their funding stream, I guess had already been made an arrangement with LabCorp to use LabCorp for their testing. We did talk with them about processing it through our lab and sending it to the hospital, but they said they already had an agreement with LabCorp, and we're going to use LabCorp for their testing.
Because we're having it for the 25th at my church.
Mhm.
We're using Trident.
Mm-hmm.
So I just wanted to make sure that they said registration.
Mm-hmm.
So I was wondering how registration would help, because if they register through you guys and they're coming out in the cars, I was trying to figure out how to
Mhm.
do it.
It helps on the back end with us getting that sample properly tagged so we can get it over to the lab and in their system is really where it helps, because then they're in our electronic record, and that saves time on the processing side. Okay?
Could you talked about this in the past, if you wouldn't mind reiterating it. So people are going out and getting tested.
Mm-hmm.
But it's not the context of what testing does.
Mm-hmm.
It doesn't relieve people from the responsibility of masking it, correct?
No, the test represents one point in time. So the fact that if you tested me this morning and I was negative this morning, it doesn't mean that I can't be exposed after the test and contract the infection. So while it's good that if I tested negative this morning, that doesn't convey any protection on me going forward. So I still should wear my mask, and I'm more than 6 feet away from you all today, so I've got my mask down for clarity. But yes, I'm a nut about washing and sanitizing my hand. I wear my mask in public. I cover my coughs. I try to avoid large groups. All of those things that we've talked about before remain important in helping us to try to defer or delay, slow the transmission of this virus. And again, I've likened this in the past. We've talked about waves. Waves are a propagation of mechanical energy through a medium. This is really more like a fire. And we're the fuel for this fire. And as long as enough of us remain unburned, or we don't have an extinguishing agent, can you hear the fire captain in me? Or we don't have a vaccine that can make us unburnable, the fire is going to continue to smolder and burn in our population. And I think that, when I look at our data, yes, our cases have gone up. Yes, we continue to accumulate cases. And yes, I'm guilty of not having done the recovered count, so you can chastise me for that. It's a very long process. It's a manual process. I'm going to try to get one done this week for us. We generally run somewhere between 150 and 200 active cases in Pitt County in a population of about 185,000. The rise of our cases has been a nice, slow, steady rise. And we've never seen that geometric spread that we were concerned about. When you look at our daily case counts, there was clearly an uptick at the end of May. Some of that probably related to Memorial Day, barbecues and things like that. But then we also, that first week of June, we had graduations here in Pitt County and other counties. It's also vacation season, so people have moved around more. There's some talk that, people who vacation here from other parts of the country, specifically people who might come down here from the Northeast for their summer vacation, may have brought infections with us or be represented in those numbers. But they may be represented in the hospital number, but from a public health reporting standpoint, if you live somewheres in upstate New York and are here on vacation, that case is going to go back to New York. It's by county of residence. So it wouldn't count as a Pitt County case even if they were here visiting and got sick in Pitt County.
Are there any plans with Pitt County schools when it comes to getting staff and students back in that blended learning for the upcoming school year?
I would defer to Dr. Lenker on that. We had some very preliminary conversations when the school guidance first came out, and then we were kind of, my staff, but Dr. Lenker's staff, we're working on all three options. And now that the governor has kind of put it on the local school districts to decide if they're going to do Plan B or Plan C learning, I believe that the school board is going to address that at their meeting next week. And then we'll be working with Dr. Lenker to help him move forward with his reopening plans.
So with the testing, you said that y'all were thinking about compressing it. When will you make that announcement? Like tomorrow, will that be the first day? Well, Wednesday is the first day of the compressed schedule.
Well, I have to talk with the county manager today, for one, and I have a meeting with my management team this afternoon as well, and we will make a decision at some point today as to how to modify that schedule. And we want to make sure that the testing remains available. We have right now a fixed amount of funding to support the testing, and we're burning through that very quickly. So it's great that we're getting all these people tested, but we're also going to be out and not be able to continue the testing. So we've kind of got to balance the acquisition of it, and then also balance the post-collection processing, and most importantly, our staff safety.
So that's going to be on the list.
Representative Smith, if you could give public health more money, we would gladly take more money. And if those funds, public health funding is so siloed. And real-world public health problems don't usually exist in a silo. So anything you could do to help us with getting some freedom to go off leash or outside that silo would be fantastic.
So, are you going to make any recommendations about, this is who should come out and get tested, and maybe people in this category shouldn't be tested?
One of the things that the commissioners were very clear with is that they wanted anybody who wanted to be tested. And so at this point, we will test anyone who presents for testing. The capacity seems to be there in the Vidant system to support that at this point. So I don't see that we would impose restrictions on who could be tested. And it was a desire of the commissioners that there not be any requirements in terms of who was tested and not tested.
So this is part also of the state's 300 sites that Dr. Coleman was stating they wanted to have in minority communities. Is this partnership with that?
This was established with money from the CARES Act that was sent down to Pitt County. So this is outside of that CHAMPS program. I think that's what you're talking about, Representative Smith. Vidant is a vendor in the CHAMPS program, and some of the collections that they're doing is through that CHAMPS project that Dr. Cohen started. And we may partner with them on some of those as well.
So this is considered like differently?
Mm-hmm. Yep.
One last thing, education materials. Once people are tested,
Mm-hmm.
are you all giving out educational materials on the
Mm-hmm.
site?
And we have handouts that we give out to folks. Yep. Yep. So we have materials that are given to folks when they're tested. Yes, ma'am.
And this is something different?
This is that's the compact study. That's the Dr. Kipp study that we've been assisting with in terms of they received money. ECU received money through state legislature.
Yes, we did.
Yep. To do this.
This is a separate funding stream,
Yep.
not the CARES Act
Yep.
or state legislature.
Yeah.
It's separate funding through the Division of Public Health funding stream.
Mm-hmm. Yep. So we have been working with them, and your survey's up and running now, right? It's open.
The survey's up and running, yep.
So that's been an ongoing project, Representative Smith. You're welcome.
Anything else or final statements?
No, I think that's. Did you have other questions, Amber? No. Oh, we do have Lee Guth is here and had some comments as well. All right, thank you all.
Good morning, everybody. Lee Guth. I am the North Carolina Cooperative Extension Director here in Pitt County. And one of my roles as the Extension Director and part of the Pitt County team is to supervise the Leroy James Farmers Market. And as some of you may know, we had to institute a temporary policy earlier this week about temporarily removing craft vendors from the farmers market. This is a temporary policy to try to improve our COVID safety at the farmers market. I truly appreciate the burden that this has placed on displaced artisans and craftspeople, and I've heard from many of them over the last 2 days. This is not a measure that we took lightly, and we consulted with legal and health department teams, the county manager's office, and with local food experts to try to craft the best solution that we could find at this point. And so the concept is, with temporary removing those artisans and craftspeople, we will have spaces available where we can further distance our farmer and food vendors in the market. For the artisans and craftspeople that have been displaced, we are going to continue to advertise for them on our website and social media. We are offering during market hours a safe place for those vendors to meet a customer. If they sell something online or through other connections, they can meet at the farmers market during market hours to safely exchange goods and payment. And craft and artisan vendors, in addition to our produce and food vendors, have the option to go online with a new website we are developing for the Leroy James Farmers Market, and it allows customers to make a order for a product and to pay online for those products and then be able to pick them up at the market. And so this is another option that those vendors have. We've been rolling this process out for the online ordering since early this year. And while the site has not yet gone live, we're waiting for just a few more folks to sign up so that we can do that. I'd also make folks aware that this is not, while again it is a blow to many people locally, this is not something that is foreign to markets across the state. So when the pandemic first hit in North Carolina, we were fortunate that the governor recognized farmers markets as being a provider of essential food, and we appreciate that. But there were many markets across the state who their organizing body or their municipality did not allow markets to reopen because of COVID safety. And in other markets, we saw them open perhaps later than they normally would. In other situations, they opened without craft vendors and artisans. They only opened with essential food services. And the Nash County market is an example of that made changes to what they would provide. And so here at the Leroy James Market, we were open for the first time year-round and opened in January with a full market offering. And again, unfortunately, we're going to have to make this change. Plan on it being temporary and look forward to having a time in the future where we can have those vendors back with us. Any questions for me? Wonderful. Thank you for your time.